Hello, I'm Olivia, one of the customer product consultants, and I'm going to discuss ways to enhance your clinical processes in Merlin. By the end of this webinar, you'll have gained insight of composites, short text, custom protocols, autosave clinical notes, generating documents via code entry, and VetConnect Plus. The first topic I'm going to focus on are composites. Composites make it easy to sell multiple items or bundles at once by selecting just one code from the treatment list. A good example is when you're selling surgery codes. For instance, the dog castrate code acts as the parent code set as a professional fee, and then you attach the individual stock codes, such as the pre-medication drugs, buster collars, GI food, meds to go home, etc., as composites. And there are a lot of benefits to using composites. One of the big ones is that it helps make sure all the right codes are added when the user is adding treatments onto the pet's record in Merlin. It's also really helpful if you've got new staff members or locums, as it reduces the chance of missing something and makes the process more straightforward for them. Composites can also be added onto vaccination codes. They can include the actual vaccines such as kennel cough, L4, DHP, etc., and even maybe a 6-month health check. I'm now going to show how to utilise composites. Navigate to Administration, Code Entry and Code Maintenance, and in this example, I'm going to show the pre-existing setup of a dog castration code. So I'm going to select Operation from the left-hand side treatment type, and now search for the procedure. As you can see, this code appears in bold, making it stand out to let you know it already holds composites, which is a great visual. I'm now going to select the code and press Edit, and select Composite from the left-hand side. And now all the existing composites will display. If I wish to add more composites, I can select all codes or select the relevant treatment type and type in the search box for the other codes I want to add. So in this example, I'm going to search for Metacam. I'm going to double click on the selected code, and there's now a choice of tick boxes. As you can see, copy and inherit are greyed out for this one, but I'll explain these in a moment. These tick boxes relate to whether you wish to have this Metacam as a mandatory item or not, and whether you want it to deduct from your stock levels. Once you've made your choice, press OK and save it. Other advantages to using composites are that your clients will see a simplified invoice with a single charge instead of a breakdown of many smaller items, which can be less confusing for them. Items will be automatically deducted from your stock levels if you wish for this to happen, streamlining inventory management, and you're able to run a report to see how often a particular package is used, aiding in business analysis. Still looking at this dog castrate code, I'm now going to show how you can utilise composites within composites. I'll now search for another code, for example, an IVFT code. As we can see, this is in bold, so I know it already holds composites. If I now double click it, we can see we get the same composite item window as shown previously, but now the copy and inherit composite items are not greyed out. If I select Inherit, any future changes made to the original child composite will automatically be reflected in the dog castrate code. On the other hand, selecting Copy will create a static version of the original child as it is now without applying further updates. In this example, I'm choosing Inherit, and when I press OK, this IVFT code includes a given set, catheters and fluids, which now appears in the dog castrate code as well. Making use of composites reduces admin time spent entering individual services, helps prevent undercharging or mischarging, allowing your practice to streamline billing and efficiency. It can seem a little overwhelming at first if you've never set composites up, but we have a team of customer product consultants that can support our practices through this. I'm now going to move on to short text within the clinical notes area. Short codes can be used for abbreviations in veterinary terminology and to create some basic commonly used templates, and using these offers several benefits. Before I discuss the benefits, I'll show you how to set these up. Navigate to any patient record and click Clinical. At the very bottom of this window, there's an Enable Short Text tick box, which must be ticked if you want to use them, and a button to open the short text library. Any previous short codes will now show, and to add a new one, type it in the top box and then add the description on the right hand side. For example, BIOP, and now the description of being in owner's possession. Now press Save, and once saved, we can see that when I now type those 4 letters into any box and press space, the description shows automatically. Another example is if I look at the GA short text name here, the description has been created with carriage returns. So now, when we type the name into a field and press the space bar, the pieces of information show as a paragraph rather than the full sentence. Another example could be to create a post-op check template. The short name could be POC, and then the description could include wound, pain score, vitals, plan, next steps, etc. So once this short name is added into the clinical notes area, it gives the user a bit of a prompt to fill the information in, ensuring that no steps are missed in that post-op check appointment. Short text codes are really handy to use as they allow users to record information quickly, ensure consistency, allow easy communication between all staff members, and can help with any spelling mistakes for long medical terms. I can remember when I was in practice, we received a clinical history from another practice and our team couldn't understand a couple of abbreviations that had been added, so using short text reduces any potential misunderstandings. Similarly, for insurance claims, you don't want to run the risk of sending a claim and some of the clinical history not making sense to them. Using shortcodes for templates is so time-saving, especially for new or less experienced staff members. The shortcode templates can act as guides, helping them to adopt proper documentation habits early on. The final thing to mention about short text is these can be set per user. In the treatment settings area, there's a setting which can be ticked to enable individual short text codes. This means each individual Merlin user can tailor codes to fit their specific workflows, terminology, and preferences. I now want to discuss custom protocols, still looking in the clinical notes area. As standard, the default protocol displays when you enter any patient clinical notes area, and this follows the SOAP method with the headings of history, examination, diagnosis, and plan. Many veterinary practices are beginning to recognise the value of implementing custom clinical note protocols. These tailored protocols can reflect the unique needs and services of the practice, whether you're a first opinion clinic or a referral centre. For example, a nurse-led weight clinic could include a protocol name of weight clinic with headings such as exercise routine, eating habits, mobility, and pain score. These headings prompt focused discussions with the client, ensuring that the consult covers all relevant areas so critical details are not missed. It also ensures consistency across the team, so every team member documents these consults in the same way, promoting continuity of care. Whilst we're still looking in the clinical notes section, I'm now going to talk about auto-save clinical notes. This setting can be enabled within the treatment settings area under Administration, Settings and Treatment. If a user is typing their clinical notes and leaves their workstation for approximately 5 minutes, an autosave indicator will appear here in green. The notes will remain open without logging the user out for approximately 4 hours. After 4 hours, a warning message will display asking if you want to remain logged in, and if the user presses yes, then the document will be autosaved again and the timer reset. If the user does not click anything, they will be logged out at the end of their Merlin's normal auto logout period. As default, the auto logout period is set to 60 minutes, so therefore they will be automatically logged out in 4 hours plus 1 hour, so 5 hours. The clinical notes will then be saved in the Add Treatment tab with a disk symbol. This feature ensures the notes are automatically saved, reducing the risk of losing vital information, and it allows staff to resume their work without having to re-enter information, which saves a lot of time. How many of us have been in the situation before where we're in the middle of typing up notes, an emergency walks through the door, or another colleague is asking for help with a patient? This feature helps to reduce the stress and gives users peace of mind knowing their notes won't be lost. I'm now going to move on to generating documents automatically using code entry. If we look at this dog castrate code, edit it, and go to treatment options on the left-hand side, we can see there is an Enable Documents button. This is where you can attach a document such as a post-op form. This means once you add the code as treatment, Merlin will trigger a pop-up prompt to ask whether you want to print the document attached, and the user can say yes or no. This saves so much time and streamlines workflow as you don't have to remember to search for the form on your PC to send to the printer, helping to ensure that important documents are not forgotten. I know when I was in practice, I'd discharge a pet who'd had a neutering procedure, and sometimes I'd completely forget to grab or print the post-op form. So having this feature in Merlin reduces that human error, as there's less reliance on memory and manual steps. You can also feel comfortable knowing that clients leave with clear, consistent aftercare instructions, which increases their confidence and trust in your practice. Now, moving on to our final topic, which is VetConnect Plus. Merlin has a seamless integration with VetConnect Plus, where you can request internal and external diagnostics through Merlin directly to VetConnect Plus, and once the results are available, they will automatically show in the Patient History tab, which can be downloaded and printed if required, and all relevant users will receive an internal message notification. This integration saves so much time, as you don't need to switch between systems, having to download and upload test results. As the results are sent via Merlin's internal messaging feature, it ensures that test results are not missed, and the message contains a link to the patient record that you can double-click and access. Because test results are automatically stored in the patient file, your practice benefits from more accurate record keeping. This not only supports clinical continuity, but also enhances the level of service you provide to your clients. As the test results can be viewed directly from Merlin, your team can make more informed decisions and communicate those results quickly to clients, improving client communication and trust. I remember when I was in practice, there were many occasions where we'd received external lab results to the practice email, and sometimes they'd get lost as we were receiving so many emails every day. The vet wasn't aware the results were available, and clients were calling in a bit of a panic, wondering what their pet's latest blood results showed, as no one had informed them. When we did eventually see the email and show the vet the results, they'd have to then take time interpreting the results, planning and finding that admin time to call the client. So I'm now going to show a quick workflow of requesting an external lab test. So we first navigate to the client record and double click into the patient's account. Now from the top of the screen, select Order Lab Test. This then opens a new window and we're able to select Reference Lab and now select the species and the gender from the drop-down options. Now press Begin Order. It will remember your most frequently requested tabs, and you can even favourite your most common ones if you choose to do so, potentially saving time in a lot of instances. I'm now going to select this test, scroll down slightly and press Order. A new window will appear with 3 questions required from VetConnect Plus, then press Place Order. We'll now see the requisition form, and this must be printed to go with the sample in the biohazard bag. Once we close this, a new line will be added into the patient history screen to let you know this test has been requested. The setup is very straightforward. Our engineers will do the background setup, and you just need to enter your VetConnect Plus credentials into Merlin's settings area and ensure the relevant users are added into the appropriate messaging group. I'll now show how the results display and how we can easily access them. As we can see, we have one new internal message. If I click into this, we can see we have some new results for Kane Smith. I can now view the results by double-clicking into the pet's name, attached as a link here, which will then direct me to the patient history screen, and I can see the results are now here. We can double-click on them, and they will display for us. This document will also display in the Patient Document tab for future reference, and they can be opened from here also. So that brings us to the end of this webinar on ways to enhance your clinical processes. I've put some contact details on screen for anyone who would like to have some further conversations about what's been shown today, so please reach out. Thank you.